Good morning, good evening, good afternoon, everyone. My name is David Rabuor. I am working with the Community Action for Health and Development. We are based in Kenya, Homa Bay County. I am the founder and the director. Currently, we have programs that have been affected by the order that was given by U.S. Current president. And this has really dealt a blow on our local organization. Actually, the funding that we were getting, we were subcontracted from the paper and other partners of the USAID funding. And this is actually what really had affected most of our work in our community. The programs we are undertaking are the ones that are based in schools. We are supporting ECD, Early Childhood Development Program, and this includes mental health management, early childhood development that starts supporting the children from the early ages, formation of the school health clubs. This normally you said the program that is called the Dreams. So the Dreams, we are supporting those girls that are HIV positive but are still in school, and most of them are teen mothers who have given birth but have also been infected with HIV. So those ones we've been supporting them in nutritional supplement, referral services, and continuous psychosocial counseling for them. Then it was also the program that was also sponsoring these students. Those that could not go to school have no school fees. The program was supporting their education fully, both in the tertiary education and the TVETs, the technical support services. So these children were positive and some of them were being followed. We were supporting even their nutritional component where every month they're given foods to support their families. The other program is about HIV positive menstrual health, menstrual health, and in component of positive persons in mental health healing. So we were supporting them with the ART therapy counseling, nutritional supplements that they are collecting every month. So this was something that we had a support program for HIV positive women living with HIV and girls living with HIV. In those cohorts, we were supporting them every month with the ART counseling, how they can take their drugs continuously. And that includes support from the counselors that are trained on how they can go about it. So currently, that one, I think, because of the effect, despite the fact that ARVs they are getting, but then conforming to the standard and putting them not having something like maybe they have trauma. So counselors will come to support their menstrual, their mental health and well-being. And that one is now a burden that we need to go about. And then in their component also, you are giving a food basket that they are collecting every month from our organization, purchases that are being done, including sugar, salt, those kind of components that have the nutritional value. The other one is the sexual reproductive health. We are dealing with the minority groups, and this had also affected most of these minority groups in terms of the commodities that include condom, and those that may not use the condom, there are also other commodities that you are purchasing to them. So this again had also been affected because now there is no floating money in that program to purchase the commodities. The other aspect is the technical support that was including supporting the salary of the staff. Like we have volunteers, we have community mobilizers, we have clinical officers and counselors. These were supporting the program wholesomely. So this has also been affected at some level with the US order. Okay, the impact currently, I think most of beneficiaries that were registered in our organization, when we got that the information. I think it was just abruptly through the radio and through the newspaper. It was a shock to most of the beneficiaries that the organization have been supporting. Even though later, after 2 days, we got a letter that was saying that we need to stop the program from the donors and some grantees that have been giving us the funds. So that is the situation, I think, so far. But we are happy that most of the organizations are coming in, and the community are now also trying to understand that we need to have locally generated institutional networks and even support that comes from the community on how to uplift the livelihood and still continue with the organization. It was something that I think the cuts came as a shock as an organization, because now even the staffs that we have that were actually 100% relying in the funding, their fate is not known. I had for 15 staffs, including me, and that means that even in our next 3 months or 1 month, we are not sure whether they will get something, but we still hope that there could be avenues that can open up. Um, uh, uh, some of these projects that we are talking about, that like the ones that I've aligned, like most of them, it is a confusion as other people as well as us in the country and as organization. Maybe the little that we had, like this month, we are projecting that we are going to buy those purchases. Of course, we don't have the funds currently to buy them. And then keeping on psychosocial support programs, it is a halt. But we are just trying, still standing to see if other avenues can get open. But currently, most of our activities, people are just coming to the office, but still thinking that there's nothing that will come at the end of the day. There's the other general way about um, we don't have currently the money to support the staffs and even to pay for those other communities in terms of supply. And I think that is the quagmire currently, because we were dependent mostly on the funding that was coming from the PEFRA and others that were also subgranted. And currently, when they are cut, we have no hope about it. But we are thinking maybe from these other things, maybe things will start working, and then we can get some things. Possibly, the cuts have really painted, giving a picture of the African nation, and including Kenya, that we should start strategizing as a nation on how to support some of our in-house things. Some of these projects, some of these people that we have dependent so much on the donor funding, but the country must stand up, including the civil society, to see how to start locally led domestic resource mobilization, so that we can have a reliable source of income that supports, even though other people may need to support us to some extent, but that locally led resource mobilization is very important, to have something that you can support at the time that there are no any other donor funding. But over and above, the effect of this is not only affecting the African, it's affecting because all of us, in terms of productivity, in terms of economy, in terms of security to even the US, because people who travel, people who come to the country still can be infected as a result of this cut. So when the drugs and when people are prevented from infection, the security of both the countries at the local level, international level, and the global atmosphere is paramount, because the interaction is everywhere. And this is something that I think most of our partners will understand, that the cut has really affected both international and a global sphere in terms of health and security of certain nations. I will say that I'm consenting that this information can be put in a video and can be used as in terms of a newspaper to spread the type of agony and what we are going through as an organization and as a country currently. It is a shock to all of us, and we think that maybe through this, some people can come to our aid and still support. I have currently over 60 beneficiaries that were on ART that were dependent on this kind of grant that you are getting from USAID. And I think from here, we can take it along that any other partner, any other well-wisher who is wishing to come on aid to support the current programs and to continue with it, we shall really appreciate. And I will say thank you so much. May all be blessed, and we hope all will be at its foot and all the best for all of us. Thank you so much. Yeah, we maybe just this for us. We are still looking for funds. Actually, apart from this project, we are also in the disaster risk management, and currently, last year we had a lot of IDPs, and some of them up to now have not been removed to those places because their families, their like their livelihoods were affected, their homes were swept with water. So it's something that even currently they are so worried because we started seeing that those points of rains coming. But even apart from that, there are those families that have been affected by sand harvesting and some of the soil mining, and still not in the same places where they are. They are in the IDPs camps. And so this is something that we can still hold that as a program, we still believe that it is something that some other partners can come up and support wholesomely.